My name's Jimmy. I've been a patient to Dr. Kevin for about almost 2 years actually now. Uh, I came in because my hip was bothering me. It got to the point where I couldn't walk a long distance without it hurting. I would have to stop and try to stretch. Matter of fact, actually some of the things that I learned here, I was actually doing myself. Like stretching my leg, my back, trying to do things. But it still got to the point it was still bothering me a whole lot. I mean, it was just a temporary relief. And my sister Adele was coming here to it wasn't called Maximize Living at the time. It was a doctor before Dr. Kevin. And she was coming here before, and then Dr. Kevin took over the practice from the previous doctor. And she always telling me, well, you should go see this, you should go see this. So, like I said, it got to the point where I said, well, I need to do something. My hip was just bothering too much. So I made it, she said, why don't you call them up and let them know. She referred me to the doctor, Dr. Kevin. And so I made the appointment and came in, and he saw me, and we went through the initial consultation and things like that. Then he made an adjustment, and then we came back and he went over the x-rays with me, and my wife came with me because she eventually became a patient too, because she had a sciatic nerve that was bothering her. So she actually came in too and did it. So we did the consultation, and I'll say within 2 weeks, 3, something like that. It was less than a month. My hip stopped bothering me. I mean, it got to the point where I could walk and do things, and it's just things just got better. Where I can, I didn't have to worry about this and that. I said I can walk. Because I stand a lot at work and walk a little bit. And of course, the floors are hard. So when I did that, things just got better. I didn't have to worry about stopping and bending and twisting and doing this things. And felt my health getting better. Wasn't getting sick as much. Because you would get these coughs and colds and things, and then I was taking the flu shots, and being here, talking with Dr. Kevin, you don't want to put all these things into your body. You don't want to put, even though they said it was a dead virus and all this stuff and things, and then things that you didn't want to put a lot of drugs and all this other impurities into your body. You're trying to keep your body pure, and you don't want to put all this stuff in there. Like when I was in the Army in 1976, that's when they came up with the swine flu, and you found out later said you had more people die from taking this actual swine flu shot than people died from the flu itself. And I noticed then that was one reason why at first I said I wasn't going to take any flu shots, because we had to take it back then. And I got sick as a dog. We came back on leave. I was on leave. We were coming back. I only could drive like 30 minutes into the drive, and our drive was 8 hours. My wife had to finish driving because I got so sick I couldn't. I guess that sounds hard as it is. I just got so sick. I mean, I couldn't think and everything else, and from that point on, that's why I said I wouldn't do a flu shot. But then, like over 30 years later, I found out that I was going to go and take a flu shot, because that's what they say. Well, when you get over 50, you should take a flu shot and things. And I took the flu shot. I mean, it didn't bother me, but after I came here, then Dr. Kevin said, well, you should do it because you're just putting impure things in your body. You know, your body is, as they say, is your body is a temple. So you don't want to put impure things into your body, and that's why last year I took it a couple of years, and then last year was the first year I didn't take it. I didn't get sick, so I know this is helping me out. I mean, if I didn't take it and Stu was coming here and I got sick, I said, well then, yeah, okay, Dr. Kevin's not right. But no, they are right. Because I didn't get sick. I mean, yeah, I might get a little cough or something, you know, something like that, but I never got sick. Not like a lot of people did. You know, people get in there and be sniffling and coughing and hacking and everything else, but you know, things are just better.
So what would be the number one thing you want people to know about trying this out, coming in?
Come in and try it. I mean, what is there to lose? You know, you'll actually find yourself getting better because everything is natural. I know this. I'm the type that I don't like to talk about myself or things. I'm pretty much a shy type person. That's why I stop and try to think of things, how to word things. But if you want to get better, improve your health, come in and try it. What's there to lose? You know, there's nothing to lose. You know, do you want to keep paying all these exorbitant money and your time to doctors and stuff?